While this pandemic continues to grow, our frontline workers, along with the doctors and nurses, are doing heroic job to protect us. In fact, they have been putting their life at risk to handle this pandemic at different levels. To share his experience from the front line, today I'm honored to welcome Dr. Shobhit. He is the emergency medical specialist at Khu Tech Fort Hospital, Singapore. Really appreciate taking out time to talk to us, sir. How have you been?
Thank you, Nisha. Thank you for inviting me. Yeah, it has been quite tough for last few months, but looks like we are getting used to it. And it has become, as you have said, like part of our life now, So we have started to live with COVID and the situation surrounding COVID.
Exactly, sir. So as you see, all the frontline workers have been fighting this battle of pandemic since January 2020, and it's been almost 6 months now. What is the new norm of life looks like you?
Okay, so life to begin with, when this pandemic started and different workflow and the working condition started as well. So it was quite challenging to begin with because we had to. So I'll just give example of my hospital where I have been working. So
Okay,
mine is a tertiary care hospital in north of Singapore, and is
okay.
a big hospital. And it covers almost, as I told you, most of
Mm-hmm.
the north of Singapore. So when this pandemic started, so we divided our hospital into, or in fact our department, which is emergency department, into
Okay.
clean and dirty zone. So clean where
Mm-hmm.
we can see the regular patients, and dirty where
Okay.
we see the patients which are with respiratory conditions, and the
All
one which
right.
are related to COVID. So it
Okay.
was big challenge to begin with. So because the hospital in Singapore are very limited with the space, so we had to
Yes.
establish or put a tent outside, and then
Okay.
all the dirty cases, means which are related to COVID, they used to go over
Mm-hmm.
there. And the other clean place which we usually use it for our usual emergency patients, so
Mm-hmm.
that was also in function. So
Okay.
it was challenge in terms of manpower because we needed
I
more manpower to deal with this situation. And we needed two teams. So one team who handles the inside, which is regular patients, other team handles the corona or COVID related patients.
okay.
um, and at the same time, it was quite tough to begin with wearing this personal protective equipment, which we call it as PPE.
True
That
PP.
is, that is, we have to wear N95 mask, and you have to wear screen, you have to wear gown. At the same time, you have to wear all the gloves and foot covers and everything.
Correct.
So, as you know that Singapore is hot, so
Yes.
it was really challenging to function in tent with all those things on, right?
So
And
painful.
yeah, so our shift used to last for 8 to 10 hours, and
Okay.
by end of the day we were really dehydrated and exhausted. So
Um,
it was more tiring shift rather than the regular shift which we function as.
mm-hmm.
um, and the other challenge which we experienced was that, of course, if you have to go for your needs, right, you have to go for break,
Yes.
you have to take
Yes.
off your all this PP, and then again you have to wear it. So it's quite
Oh,
painful from that point of view as well, right? And
true.
it is quite fortunate that Singapore was well with resources,
Yes.
so there was no shortage of any of these things. But I
Mm-hmm.
know that places in India and other parts of the world,
Yes.
doctors really struggle to have all these
Exactly.
yeah, PPEs,
Exactly.
and
Correct.
they had to just manage with one, right? So throughout the shift they won't take off their attire, and they will somehow, in fact, in some part of the world they were even wearing diapers and all, right? So that
Oh,
they
yes.
were so busy and they didn't have chance to even change their clothing also,
Yes.
right? Yeah.
Oh,
So
that's
that way, I should really thank our Singapore government, which helped us in providing all the necessary medical facilities or equipments
mhm.
needed for healthcare workers.
Okay. That's so nice of
Yeah, yeah,
Singapore government. They
yeah,
have been
yeah.
managing so nicely. Like I want everyone around the world, especially India and other parts of the world, to learn all these things from Singapore.
Yes, yes. So their organization was quite good.
Mm-hmm.
That was first challenge. The second challenge was we have to always start our shift early because every
Okay.
day there will be some updates on workflow, where to send the
Yes.
patients. And
Okay.
the second challenge which most of the hospitals were facing when they started was that when this COVID patients started coming to hospital and they started getting admitted in hospital, it
Yes.
became like very crowded. So the inpatient team was really very much overworked, and there was not enough space. So it so happened that the government, they opened up separate COVID related ward at Singapore Expo and Singapore
Yes.
exhibition center. So that was quite relief, so that we started moving patients from our side to their side. Still there used to
Okay.
be long waiting lists, so we had to take care of all those patients. So those patients were not just 10, 20, they were in few hundreds. So it
Hundreds,
was
yes.
it was really
Sometimes it
tough time.
was thousands also, I heard.
Yes, yes,
Yes.
yes, yes. So the and they, so hospital had to create a lot of tents and lot of other temporary places where they
Mm-hmm.
can place these patients before they move to the expo or any of those places.
Yes, sir. True, true.
Yeah, these were the few challenges to start with, but
Yes,
as we moved on, things started settling slowly, slowly, and now looks like number have started going down as well. So
exactly.
we are much more comfortable to handle this as compared to when it started with.
Yes, sir. So all thanks to
Yeah,
you and the entire team who has been doing all this thing to protect us.
yeah, yeah.
Okay.
So that was something which was very challenging.
Okay. Okay. All right,
Okay.
sir. So my another question would be like authorities here in Singapore are taking care of COVID-19 patients with utmost care. Back in India, many of the COVID-19 patients being home quarantined, staying alone. So what advice would you give them for managing their mental health?
This is not just to India, it's for all these COVID patients in any part of the world, including Singapore.
Uh-huh.
So, as you are aware that most of the patients in Singapore are the workers which are from either India and mostly from south of India, and
Yes.
there are few many from Bangladesh as well. So,
Yes, sir.
that creates, because they come here and they stay alone, and
Yes.
they once they have been diagnosed with COVID, so they think that it is like a life sentence, and they are really worried. So there are two
Yes.
parts of it. First is they are very anxious, and
Yes,
second they
sir.
are very and during this process, because they are staying alone and they have been isolated, so that
True.
brings up depression also among themselves.
True. True.
So these two are the most challenging part from psychological aspect for these patients.
True.
It so happened that some even tried and even did commit suicide also,
Oh my
because they were
God,
so
that's so
suppressed
sad.
and they were so depressed, and they think that they are not going to make it and they're going to suffer further. But we should understand that COVID is not really such a serious disease, I
Yes.
should say, like
Yes.
cancer or HIV or some other big diseases what we know, right?
Yes.
I know this COVID virus spreads very fast. That's the biggest drawback, but it doesn't
Yes.
have such a high mortality like Ebola and other deadly viruses.
Correct. Correct.
So that is the important aspect that these people should understand.
True.
Especially all those who stay alone.
Yes.
Um, Other part, what so actually we looked into it, and we involved a lot of voluntary services as well. So
Correct.
people who can give some sort of psychological counseling for the patients who are staying
Yes.
alone, and
Mm-hmm.
especially meditation, someone who wants to join sort of webinar for religious things, which like for all Indian patients about Bhagavad Gita, Ramayana, Mahabharata,
Okay.
and
Okay.
and same for Quran for patients who are from Bangladesh, right?
Okay.
So that was one thing which we found it to be very useful. Second is
Okay.
there were advice, or there was some joint uh, like online classes for milder exercises, because they were sick, so they can't do
Mm-hmm.
very strenuous exercise, so they can
True.
just do some breathing exercise when they are over there, and
Mm-hmm.
they can do some small like limbs exercise as well, walk around a
Okay.
little bit. So that gives some sort of engagement for these patients, that
Okay.
they are not alone and this is not the
Mm-hmm.
end, and there is someone to take care of them. and
Definitely.
and so far you can see the mortality is not that high as compared to other
Exactly.
deadly diseases.
Yes,
So
sir.
So that is one of the way we can help all of them. And now, as you know, that COVID has already like spread worldwide. So
Exactly.
not just in Singapore, even in India also, there are a lot of
Yes.
services. There are a
Yes.
lot of
Yes.
now almost everyone has got mobile, right? So
Exactly.
even when you are staying alone, you can
Yes.
use any of this method to keep yourself engaged and to keep yourself learn something when you're over there, because
True.
still you are quite functional mentally, so you can look for different things, you can learn something, you can read some books, you can explore
Yes.
different parts of different other aspects of life as well.
Definitely, so that's a great
Yeah,
insight, so okay.
yeah.
So my next question would be, along with COVID-19 patients, their spouses and family members are also going through tough times. What advice do you have for them to handle this tough time?
Okay, so it's definitely challenging for the healthcare workers or the frontliners, at the same time for the family as well,
Yes,
because
sir.
yeah, so we usually give as when we started our job, we were given advice that we should not just take care of ourselves, but keep look on our family members as well.
Yes,
So
sir.
to start with, we were trying to not mix too much with them, and like you go come from work, sometimes work can be longer, you come back and you take you stay separately, you watch yourself, at the same time you try to have minimal contact with your family members. But in long term, what we realize that it is not possible. But we should try to avoid it and monitor us as much as possible, right?
Okay.
I know that because this is something when most of the healthcare workers were really busy with their work, so they can't give much time to their family. So that
True.
was really biggest challenge. But of course, as a part of our duty, we should we try to help our patients and perform our duty well.
Okay.
So I know that was difficult time for almost most of the healthcare workers to handle personal family life, and at the same time to handle their duties as well.
True. True. Okay, sir. So my next question is, we have seen effective use of telecommunication in Singapore. So I would like to ask your views on how effectively can it be used in India or any other, basically in India, so that those in needs can access it and get benefited out of it.
Okay, so this is a very good question, because before this COVID started, no one knew anything about telemedicine or telecommunication in
Yes, sir.
India. So
Yes, sir.
there were no guidelines, nothing. So something which COVID has brought in is proper guidelines. So within when this COVID started spreading, government came up with the proper guidelines, right? So that is something which I appreciate from Indian government point of view, that they were very prompt in recognizing the importance of telemedicine and telecommunication during this COVID patient, because that is one of the safest way where you can screen patients, give them advice and tell them what to look for, and subsequently follow on those patients as well.
Okay.
But other aspect of it is that and a lot of patients, which I can say that a lot of institutes, which are government institute, also initiated this service. There were few logistic issues because no one picks up the phone and it was not working that well, and doctors and patients both were not so used to handle this sort of teleconsultation. So, but slowly, what I can see that patients and doctors have started to adopt this
Okay.
teleconsultation. Yeah,
Okay.
but still there is long way to go. Both in terms of
Definitely.
doctors, because some of the physicians are not so comfortable, and they are not sure whether how medico legally it is safe for them.
Yes.
And at
Yes.
the same time for the patients also, that they are first of all they have got some sort of apprehension, but later on when they use this teleconsultation, they don't have that sort of feeling. When, like in India, is different. It works more
Exactly.
on more on emotional. There is some psychological and
Exactly.
emotional aspects as well,
True.
not just the medical aspect. So
True.
that is not really possible when you consult via telemedicine, right?
Exactly.
Yeah, yeah.
Yes.
But and the other aspects are like those physical examination and checkup of the patients, that is
Yes.
limited.
Yes.
but looks like in future all these modern modalities will come, so it may make things more easier, like you can have digital stethoscope, ECG, etc. Right?
Mm-hmm.
Yeah. But
Yes.
so these are the things which were challenge for telemedicine to start with. But looks like, but so we should understand the limitation of this service, and
Mm-hmm.
we should use in that appropriate context, right? But
Yes.
it is getting used to it. There are a lot of websites and a lot of portals which have come like that for the
Mm-hmm.
service, and they are still in developing stage.
Yes.
The time will tell that how much these new modalities are successful in
Mm-hmm.
community. So we just have to try, and then we have to watch and see what are the outcome of this in few years time.
Definitely, sir. Definitely.
Yeah.
As you know, like while we know that there have been so many negative impact of COVID-19 in our lives, so is there any positive impact also? Like, do you think, especially in the medical field, such as facilities, vaccines, innovation, and also in our social life?
Okay, so first what we have just mentioned, that we have recognized, first of all, we have recognized the use of technology
Yes,
during
sir.
this COVID related condition, and telemedicine and teleconsultation is one of that.
Yes,
Right?
sir.
Yeah.
Yes,
And
sir.
second is we have started learning to take care of ourselves as healthcare
Mm-hmm.
workers by
Better
wearing ppe,
hygiene.
yeah,
Yeah.
better hygiene, at the same time watch our and monitor ourselves, take
Yes,
care
sir.
of our health by doing regular exercise, keeping
Mm-hmm.
ourselves physically fit, at the same
Mm-hmm.
time, so those all things COVID has taught us, right?
Definitely.
um, yeah, the second aspect is not that's just medical, but that is for everyone, that people
Mm-hmm.
have started working from home, and
Mm-hmm.
a lot of companies, especially IT companies, have realized that that is probably more productive rather
Yes,
than
sir.
having office space, right?
Exactly.
This is something new which probably
True.
looks like it may continue forever, that you
Mm-hmm.
save your traveling time, you save your other logistics, you save your
Yes,
office space, you save
exactly. The
electricity
electricity
bills, and you
bills,
list,
yes.
yeah, other things. So that is for any other person who are related to healthcare work, related to healthcare
True.
or not related to healthcare. And
Exactly.
it works quite well for even students also, right? Now they go for
Yes,
online teaching and
exactly.
online learning, so you
Uh,
don't have to really physically you don't have to be with your teacher or in classroom. And
mm-hmm.
this online the beauty of this online concept is that you can have teacher from anywhere, any part of the world.
Correct,
It does not
correct.
be with the person who is next to it, so you can get your best teacher, and you have more wider choice, as we usually
Yes,
have with limited options when we want a face-to-face learning or teaching, right? Yeah.
exactly.
And the other aspects what you are saying about innovations are that
Mm-hmm.
and especially for India, like for Singapore, like this A-Star company,
Mm-hmm.
they came up with a kit for diagnosis for COVID, and they are
Yes,
working on vaccine. And
yes.
soon, and I can say that a lot of companies in India also working on that. So at
Yes,
least that develops a sense of innovation in our local companies as well, right?
true, true, true,
And it's not just COVID related. It may link up with it may work for other conditions as well. So
true, true.
yeah, yeah, of course, COVID is one of the disease, but there are a lot of other aspects also where
Okay.
this innovation will start in future.
Mm-hmm. Okay. We hope for the best, keeping fingers crossed.
Yeah, that's
So,
right.
okay. So as we understand that COVID-19 is going to last for a long time, so how do we need to prepare for our future?
Okay, so of course now we have to live with COVID, right? And
Yes.
yeah, even though a place like Singapore, which is small and looks like the first phase has settled, but we are worried
Mm-hmm.
that second phase may come up soon when they have started opening all the shops and everything, right?
Okay.
Yeah, and same for India also. India looks like even
Mm-hmm.
first phase is also not going to end so soon, right?
Exactly.
And is still
Exactly.
in spreading more and more.
Mm-hmm.
So I understand that not it's too hard to just stay at home when
True.
this COVID continues, and then people have to earn their living. They have to start working,
Correct.
and all the services
Yes.
have started. Yeah, my colleague doctors who are in India as well, they have also started functioning. They opened their clinic. So
Okay.
we have to just find ways how to survive with COVID. And
Mm-hmm.
the best way to do it is self-protection. So make sure that we take care of ourselves. If you are frontline workers, you wear proper PPE. And
Mm-hmm.
second is self-isolation. So you don't ever try avoid going to crowded places. Try avoiding to go as a group, and
Mm-hmm.
keep yourself as limited with the numbers. And
Okay.
third thing is self-hygiene that
Yes.
we have already started practicing. So I think this will
Correct.
continue forever. So once you
Yeah.
come home, you wash your hands, you
Definitely.
yeah, you change your clothes, and then
Oh,
you take care of yourself. When you
yes.
at the same time, when you are going outside also, you have to be careful. You use your hand sanitizer, you use your
Definitely.
mask, and you be keep yourself a bit
Mm.
far off from the usual crowd. So that's how looks like this LOM is going to work for very long, right? And
Yes.
it may be years or even more longer as well.
Oh, so like, okay, we hope to it for it to end
Yeah,
soon. We can just
yeah,
hope and we can wish for the best.
yeah.
And
That's right. That's right. But we have to be prepared that it's not going
exactly.
to be over in at least 1 year. It will take longer than a year.
Oh, the good for good. Like through this channel, we can let the public know that they have to prepare themselves for the future. Also, it's not just not
Yes.
going to end soon. Okay.
Yeah. So we have to find some way to live with it.
Okay. Okay. I
And yeah.
understand.
Okay.
Okay. So will it change the way we practice the medicine in future?
As you know that we have already done a lot of modifications to our work now.
Mm-hmm.
Uh, we can see that I'll just give my experience from Singapore that we
Mm-hmm.
have started learning to live with it, and our medicine also have like my medicine medical practice also have changed. So
Mm-hmm.
anyone comes with a respiratory symptoms or fever, we always have a suspicion for COVID, and
Uh-huh.
probably it will continue for long.
Okay.
Second thing is we have started using all the different ways to monitor as well as to follow up on our patients. So there are a
Mm-hmm.
lot of GPs, you can say, they have come up with this telemedicine consultation for them
Oh.
patients, and they are they are trying to avoid direct patient contacts. Third
Mm-hmm.
is for patients who are on chronic medications. Our
Yeah.
government also have started supporting them, so they don't have to really go to their personal doctor if they have nothing extra to add in, so that chronic medications can directly get delivered to their own home and own place, so they don't
Mm-hmm.
have to come just for that sake to clinics. So
Mm-hmm.
we are trying to make things more available at home rather than
Mm-hmm.
patients coming to clinic and hospitals.
Okay.
So in that same line, medical home care also have started, where patients, especially elderly patients, can be taken care at home, so they don't have to, because they are the ones who are more prone to have this COVID
Exactly.
infection, right? So
Yes.
we are trying to find various ways where we can avoid them to come to
Mm-hmm.
hospital and can manage at their own place as much as possible.
Mm-hmm. Okay. So,
Yeah.
so finally, the last question that I would like to ask you is, what are the basic challenges are being faced by the frontliners, doctors, or the nurses still? As we know, the resources are available, things are falling down in places, but still, what are the challenges that the doctors and nurses and the frontliners are facing?
Okay, there are different challenges for Singapore and India.
Uh-huh.
Most of them are similar, but of course, Singapore is a small place and India is a big country with a huge
Correct.
population. So
Yeah.
definitely challenges, and with limited resources over there. So challenges
Mm-hmm.
are more over there as compared to
Uh-huh.
here. Yeah, more important thing is to uh, few of my friends who are
Mm-hmm.
the healthcare frontline workers in India,
Mm-hmm.
uh, they they have got is law and order. That means
Mm-hmm.
a lot of patients, even though they have got corona-like symptoms, they don't
Mm-hmm.
really accept that, and it's very difficult to get them tested for this problem.
Exactly.
And the second most problem is to make them self-isolate if they are positive. Even though
Okay.
patients who have got so they have been specially advised to quarantine themselves, but they don't strictly follow that, and
Mm-hmm.
they still move around here and then, and it communicates and spread from one place to another place, right? One person to another person as well.
Yes, sir.
So that is the biggest challenge. So sometimes they have to really make use of police also to get these things done. And you have watched videos in past that there have been few violent incidents also, and
Yes.
that was which is something which should not happen,
Mm-hmm.
but it's still happening in various parts of India. Yeah.
True.
So yeah, so that is second problem, and the third is, as you said, that there are very limited resources in
Yes.
big country.
Yes.
And that was the reason that a lot of healthcare workers, not just healthcare workers, all the frontliners, even police officers, also were found positive to
Uh-huh.
coronavirus, because they
True.
didn't have enough things, and the crowd is so huge over there, so very hard for a single person to manage that, right? Or live with limited
Correct.
numbers.
Correct.
Yeah. So these are the biggest challenges which has been faced.
Mm-hmm.
Then of course, so the other challenges are of the medical challenges, right? About
True.
ventilators, ICU
Yes.
beds. There is no medication yet. Hopefully
Yes.
something will come. There are different medications which doctors have been trying, but nothing
Yes.
has been proved 100% evidence-based successful, right? So it is
Mm-hmm.
still a lot of medications are in stage of experiment.
True.
These are few of the biggest challenges
Mm-hmm.
which we have been facing. But thankfully, both places, Singapore and India, mortality is not
Mm-hmm.
very high,
Yes.
unlike other part of the world. In these
Correct.
places, overall, they say the mortality is around 6%, including
Mm-hmm.
European countries and US. But
Okay.
in India, it's around 3.4, and
Okay.
in Singapore, it's even less than 1%.
Oh.
So, which is very much in control, right? So, it
Yes.
is not as bad as it was expected, but hopefully, and the reason for that, which assume, is most of the patients over here are usually young patients, right? So
Yes.
one good thing about India is that elderlies don't really move around too much, and they
True.
really, I can see that they have been they have been following the advice, and they have been sticking to
Yes.
their place, which includes my
Correct.
parents as well, right? Yeah. So these are the challenges, but then we have to face it, and things are not that bad the way we are thinking, and we are, and hopefully it will settle with time.
Yes. That's a big hope. We all
Yeah,
just
that's
want
right.
things to settle down as soon as possible.
Yes,
We have
yes,
been living it with for such a long time. Like we just want it to go away soon.
yes, yes. Yeah.
All
So
right.
okay, so it was nice talking to you.
The same here,
And
sir.
and hopefully people listen to this video, and they can understand the
Definitely.
how things are going on floor, and how this COVID is going to last, and how to be prepared to face this in
Yes.
future as well.
Yes, sir. Thank you so much for your time and all about all the insights that you gave us. Really appreciate it. Thank you so much.
Okay, my pleasure.